Hello everyone, this is Dohya Prasuna. Welcome back to my channel. I'm a third year medical student. Today we will be going to discuss about the general examination that should be done in an ENT case proforma. By the way, if you are unsure about how to take a case regarding the ENT case proforma, you can go ahead and check out my clinical series that I have linked in the description box. General examination is very essential parameter that comes before the local examination because it helps to rule out any other underlying systemic diseases and to provide accurate information about the patient's diagnosis. We'll cover each and every component in a simple, systemic and exam-oriented way along with its clinical importance. Without further delay, let's get started.
In this module, we will be going to discuss about the general examination in an ENT case proforma. Now, we have to look for whether the patient is comfortable or distressed, walking normally or required support, sick looking or healthy looking, and also notice the hygiene and the grooming. And remember, you should always start the patient's profile by these following: a built, consciousness, coherent or cooperative patient, and the orientation. In build, you have to observe the body frame. Like there are different types of build. For example, thin, average, well built, obese. The importance of this is obesity increases the risk of obstructive sleep apnea, and a poor build may suggest chronic disease or malnutrition. And the nourishment should also be assessed because there are different types of nourishment. For example, well nourished, moderately nourished, and poorly nourished. Poor nutrition delays wound healing and reduces immunity and increases susceptibility to infections. And height and weight also be recorded along with BMI, that is body mass index. And also the cooperation of the patient is very important, since children and patients with pain or hearing impairment may not cooperate well during the examination. The level of consciousness is an important parameter because it altered consciousness may occur in severe infection, meningitis, head injury or complication of ENT. And next comes the pickle and the pressures. Firstly, pallor. Pallor is the paleness of the skin and mucous membrane due to decreased red blood cells or blood supply. It is most commonly seen in the lower palpebral conjunctiva, tongue, soft palate, palms and nails. And the conditions associated are dysphagia cases, throat carcinomas, nasopharyngeal angiofibroma, PV syndrome, and finally atopic rhinitis. Now, icterus. It is the yellowish discoloration of skin and mucous membrane due to increased bilirubin. We have to check the sclera and hard palate and also the skin and mucous membrane. Liver diseases affect drug metabolism and it's important before anesthesia and surgery. Moving on to the next topic, that is clubbing. It is the bulbous enlargement of soft parts of terminal phalanges, the intestinal edema and dilatation of arterioles and capillaries, and also the curving of nails. There are 4 grades mainly. For example, first is softening of nail bed, second one is obliteration of nail bed, third one is parrot beak or drumstick appearance, and finally hypertrophic pulmonary osteoarthropathy. It is important in ENT because it is associated with bronchogenic carcinoma, tuberculosis with secondary infection, lung abscess and mixed edema. Now, cyanosis. Cyanosis is the bluish discoloration of appendages due to increased amount of reduced hemoglobin in the capillary blood. We can check the cyanosis in the spots like lips, tongue and nail beds. The ENT importance is it may indicate severe airway obstruction, laryngeal edema or respiratory compromise. And there are 2 types of cyanosis, that is central and peripheral. Central is the decreased arterial oxygen saturation that is seen on skin and mucous membranes, and the peripheral goes to the decreased blood flow to the part seen only in the skin. Next most important topic is the lymphadenopathy. Lymphadenopathy is the enlargement of lymph nodes, inflammatory or non-inflammatory in origin. Neck nodes are examined by standing behind the patient with patient's neck flexed. Nodes are examined from the above to downwards. And it is also important to note the neck nodes because it's going to be your Viva question, that are submental, submandibular, tonsillar, cervical, post-auricular and occipital. Several diseases affect several type of lymph nodes. For example, Tuberculous lymphadenitis affects deep cervical, axillary and mesenteric nodes. Syphilitic lymphadenitis affects the epitrochlear and occipital nodes, and lymphosarcoma involves the cervical glands. In Hodgkin's lymphoma, the cervical glands are affected, and non-Hodgkin lymphoma, the supratrochlear nodes are affected. Now, edema. What is edema? It is the collection of fluid in the interstitial spaces or serous cavities. Edema occurs when 5 to 6 liters of water collects in the spaces. Pitting on pressure occurs when circumference of the limb is increased by 10%. And as you know, these are the ENT cases that are associated with edema. For example, angioneurotic edema, cachexia in malignancy, liver metastatic carcinoma, mixed edema, and finally metastatic lymph nodes pressing on the lymphatics. Now, the temperature. Fever is increase in temperature by more than 1 degree centigrade or any rise above maximal normal temperature. It reflects the temperature of viscera and tissues of the body. The sites for looking temperature are oral, axillary and rectal. Normal body temperature in Fahrenheit is 98 to 99 degrees Fahrenheit. And there are mainly three different types of fever, that is continuous, remittent and intermittent. And the conditions associated with fever are thyrotoxicosis, infective mononucleosis, specific infections like diphtheria, tonsillitis, Vincent's angina, and CSOM with intracranial complications. And also remember that if a patient comes to you with a high fever, and it's most likely due to an infection in his ear or nose or throat. Next most crucial part is the pulse. The components of pulse are anacrotic wave, tidal or percussion wave, dicrotic notch, dicrotic wave. Normal pulse rate is 60 to 100 per minute. And there are several types of pulse. For example, anacrotic pulse is bifurence, dicrotic water hammer pulse, and etc. The conditions like anemia, thyrotoxicosis, and fever are most frequently associated with tachycardia. Now, the blood pressure. Blood pressure is the force exerted by circulating blood on the walls of the arteries. It is one of the 4 vital signs and is measured during a sphygmomanometer. The systolic blood pressure reflects the stroke volume of the heart, stiffness of arterial vessels, and the diastolic blood pressure reflects the peripheral resistance. Normal blood pressure is up to 120 by 80 millimeters of HA. The hypertension is persistently elevated systolic or diastolic blood pressure. The hypertension mainly leads to thyrotoxicosis and raised intracranial tension, and the hypotension mainly leads to the tuberculosis, anemia, functional complications, and cachexia of malignancy in mostly the ENT ear cases. Now comes the jugular venous pressure. It is the indirect measurement of the pressure in the right atrium, that is central venous pressure. It is assessed by observing the pulsations of internal jugular vein in the neck. The normal JVP consists of 3 positive pulse waves A, C and V, and 2 negative pulse waves X and Y. Normally is 3 to 4 centimeters. The elevated JVP indicates right ventricular failure, hyperkinetic circulatory state, increased blood volume, and pulmonary disorders like asthma and emphysema. These are the steps to measure the JVP, and make sure to know about the measurement of JVP on the patient. Let's now dive into the cranial nerve examinations. This here is the whole summary table of cranial nerve examination that I made. Now let's quickly revise all 12 cranial nerves and their functions and how to test them and common abnormalities. Firstly, olfactory. It tests for sense of smell. Ask the patient to identify familiar non-irritating odors like coffee or soap. Abnormalities include anosmia, hyposmia and parosmia. Second is the optic nerve. It is responsible for vision. Test visual acuity using the Snell lens chart, finger counting and visual fields by confrontation. Look for reduced vision or visual field defects. Third, fourth and sixth cranial nerves, oculomotor, trochlear and abducens. These nerves controls the eye movements. Ask the patient to follow your finger in 6 directions. Check for ptosis, squint, diplopia or restricted eye movements. Fifth is the trigeminal. It provides facial sensation and muscles of mastication. Test facial sensation with cotton or pin. corneal reflex and ask the patient to clench their teeth. Loss of sensation or weak jaw muscles suggest trigeminal involvement. The seventh nerve, the facial nerve, supplies the muscles of facial expression and taste to the anterior two-thirds of the tongue. Ask the patient to raise the eyebrows, close eyes tightly, smile and puff out the cheeks. Facial symmetry indicates facial nerve palsy. And eighth one, the most important, is the vestibulocochlear. It is responsible for hearing and balance. It assesses the hearing, use a whisper, Rinne and Weber tests and evaluate balance if required. Hearing loss or vertigo suggests pathology. The glossopharyngeal and vagus 9 and 10 nerves. These nerves are examined together. Ask the patient to say ah and observe soft palate movement. Test the gag reflex and assess swallowing and voice. Hoarseness or vulvar deviation indicates vagus nerve involvement. The 11th is the spinal accessory. It supplies the sternocleidomastoid and trapezius muscles. Ask the patient to shrug the shoulders and turn the head against resistance. Last cranial nerve is the hypoglossal. It supplies the tongue muscles. Ask the patient to protrude the tongue and move it side to side. The tongue deviation, atrophy or fasciculatious suggest hypoglossal nerve palsy. This completes the cranial nerve examination. A systemic assessment of all 12 cranial nerves helps to identify neurological deficits and is an essential part of ENT and general clinical examination. You can take a screenshot of this. After completing the general examination, we proceed to the system-wise examination to identify any associated symptom abnormalities. Respiratory system. Assess bilateral air entry by auscultation and listen for any added sounds such as rales, crepitations, rochi, that is wheezing, or abnormal breath sounds. The central nervous system. Evaluate patient's level of consciousness and orientation to time, place and person. The cardiovascular system. Auscultate the heart for the first and second heart sounds, that is S1 and S2, and examine the apex beat for its position and character. The GIT. Palpate the abdomen for hepatomegaly or splenomegaly and look for evidence of ascites, which may indicate underlying liver disease or systemic conditions. Systemic wise examination helps to detect systemic diseases that may be related to or influence ENT conditions and ensures a comprehensive patient assessment. In this video, we have covered the general examination, cranial nerve examination and the systemic wise examination in a simple practical manner. I hope this helps you during your clinical postings and practical exams and Viva preparation.
So that brings us to the end of general examination of the ENT case presentation. Now moving on to the next topic, that is local examination of the ENT. We are going to discuss a very important topic that are present in the local examination of the ear. In the next video, we will move on to the next topic, that is local examination of the ear in a ENT case proforma. That consists of inspection, palpation and also otoscopic examination in detail. If you have any questions or suggestions, you can share in the comment section below, and don't forget to like, share and subscribe my channel. Thank you so much for watching and stay tuned for more updates and videos. Bye.